Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning and Gold Midwifery. And I'm here today with two guests who will be presenting at our upcoming Gold Midwifery online conference of 2022 and have Alex Bacon and Dusty Chipura with me. Hello, you two.
Hi, Kristen.
Hi.
It's lovely to have you here. And in a minute, we'll talk about the wonderful presentation you will have here at Gold for us during the Midwifery Conference. But first of all, I want to know a little bit more about you, the two of you. Where in the world are you located and how come that you work together like this? Tell us a little bit about your background and your work and the two of you together.
Sure. Dusty, do you want to start?
No, you go ahead.
Okay. Hi, everyone. I am a registered midwife and a mama. I'm in the so-called Vancouver on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. Um, I'm very committed to equitable access to midwifery care. And Dusty and I met in prenatal class in 2017, which is kind of fun. And we've created all sorts of things together since we met. But Dusty really brought to the front of my mind care for neurodivergent people, and it wasn't on my radar at all. And there weren't many resources available. And I'll let Dusty tell her part of that story.
Hi, I'm Dusty. I'm accredited ADHD coach, master certified coach through the Professional Association of ADHD Coaches. I live sort of in Vancouver, around the area. And like Alex said, we met in prenatal class and we wrote a pregnancy journal together, just have been putting out lots of resources for pregnant people with ADHD. Because when I was pregnant, the only information that I could find was about, whenever I Googled ADHD and pregnancy, all that came up was like information about the impacts of ADHD medication on pregnancy. But there was nothing out there about how to cope with ADHD during pregnancy, especially if you discontinue or don't use medication. So I found that those resources were really lacking. So I thought I would make some.
This is absolutely amazing. I just love hearing that because, the two of you got together, you saw that there was a problem that needs, or an issue that people need information on, and which is so important, and come up together and create something because the need is there. And the two experts, Dusty on ADHD and of course Alex the midwife there. I think it's a perfect combination there, and creating these resources too. So Alex, let me ask you this: what did surprise you? You said it wasn't so much on your radar, of course. When you before you got together with Dusty, was there anything that surprised you that you thought, oh, I didn't even think about that, or or that makes sense, why didn't I think about that? Something like that, to that extent.
There were so many things that surprised me. For example, no one had ever disclosed to me that they were neurodivergent before I
Mhm.
met Dusty and started asking questions. And it wasn't until I started sharing that I was doing this work that midwives and clients started coming out to me, and friends all over. And they would reach out to me, but they didn't even want to say it publicly. It would be by direct
Right.
message saying, I have
Yeah.
ADHD. Thank you so much for talking about this. So I was surprised at how widespread it was. I was super surprised at the lack of resources.
Hmm.
When I called up my local pharmacist to ask about ADHD medication in pregnancy, when I called the reproductive mental health program and said, what supports do you have for people with ADHD in pregnancy? They said nothing. We don't accept any referrals. So I think I was really surprised by the gaps. And there was a lot of aha moments for me. I think that the next piece of work for Dusty and I to do is probably a postpartum um,
Mm.
resource or journal there, because of course all of these symptoms are going to be exacerbated by the
Right.
discomforts of pregnancy, and then you throw in the lack of sleep and whatnot, and these big life changes and the constant interruptions. And so the rates of postpartum depression were shocking to
Hmm.
me.
Yeah.
Yeah.
Oh yeah, I can so see that the two of you creating the next resource there. That's fantastic, and you're so right. Right after after the birth, there's so many things coming together. The changing hormones, the lack of sleep. That's hard on anybody. It's not an easy adjustment there. Into that new phase, and then with ADHD, that brings on another layer as well. So I'm looking forward to when you create that and come back here and talk about that as well. And Dusty, is there anything, you are the expert on this topic of ADHD, that surprised you when you looked into that? Yeah, if you saw that with your own experience, that there weren't many resources, you probably were thinking, why isn't there more? Why does it take so long for me here? I had to do it because nobody else was was doing it. So what else surprised you there in your journey?
Well, I think, it's not super surprising that this hasn't been talked about before, because ADHD continues to be underdiagnosed in girls and women. It's really only now that we're starting to have that larger discourse around how ADHD presents in, sort of more than the stereotypical like hyper little boy.
Mhm.
And then, on top of that, we actually are only really the research is only coming out now about the impacts of ADHD on hormones, right? So on people's menstrual cycles, on menopause, right? And so pregnancy is just a piece of that larger discussion of the way that people who menstruate are impacted by the hormones associated, and the impact of estrogen and that kind of thing. But I think the biggest thing is not really surprising, but the biggest thing that's shocking to me is just how uninformed most healthcare providers are. Like, I'm in so many Facebook groups for women with ADHD, and it's almost every day that I see someone saying, I just found out I'm pregnant or I'm breastfeeding, and my doctor says I have to go off medication. I'm like so scared. I don't know how I'm going to do it. And in fact, the research is far from conclusive on what the impacts of controlled and monitored stimulant medication use is. And so there's a lot of doctors out there who I actually had a client once tell me, my doctor kicked me out of his office for asking for meds while I'm breastfeeding. And and for other women, or for other breastfeeding or chest feeding people, they're like, oh yeah, me and my doctor talked about it, my doctor was totally cool with it. So from practitioner to practitioner, you might have a completely different experience, which I think is really unfair. And really, it's maddening how uneducated providers are around this.
Yeah, absolutely. And you're saying, yeah, it's unfair that, one family experienced something so totally different from the other, that one provider says, you can't breastfeed, you need to bottle feed, or you can't be on medication. And that brings me to another issue that Alex mentioned before, that disclosure, right? We've seen it here too in our practice, that, women might not want to disclose this to their care provider because they're maybe worried that either medication is taken away from them, or they can't have an out of hospital birth because then they're no longer so-called low risk in the area where I am living, for example. That would be something they might be worried about, and then not disclose it. And there is a huge danger of not disclosing it as well, because so it can impact the way the pregnancy goes, and the relationship between healthcare provider and the pregnant person there as well, right?
Well, and I found the foil. So now that I've been learning what to look for, I often find that individuals with ADHD who either aren't diagnosed or haven't
Hmm.
disclosed, we make other assumptions about them.
Yeah.
And the assumptions we make tend to not be very generous.
Mm-mm.
So I've had consultants say to me, I think this person's using drugs. They talk really fast. They're always fidgeting. They seem to be very disorganized. I don't know if they're fit to parent, right? Like, that's a
Mhm.
narrative that I've heard built up several times, and it's been up to me to say, whoa, can I present an alternative, you
Yeah.
know, um, explanation? Can we look into diagnostics for this individual? Like, I don't think
Hmm.
that this is an issue. And that's where we really have the benefit of midwives, of having this long-term, well-established relationship, trusting
Yes.
relationship. We're in people's homes. There's a trust and an intimacy that happens where we can start to recognize these signs and have these conversations with people. So I think we're in a really excellent position to be able to assist. But I also think midwives will find they're often the first healthcare provider to say to somebody, hey, have you ever considered has anyone spoken to you about this?
That's such a good point. That's such a good point. And you brought up something earlier about this, that the focus is or was, in the past, more on young boys, and that for some reason girls were less considered in that picture, right? Especially than pregnant women or women in general, because I think also, there's also a lot of shame and guilt involved in this, because as you mentioned, that assumption, oh, is this person even fit to be a mother? Our society has this view of the mother who has it together, has a tidy house, has this, everything well organized, and of course that these wrong assumptions, that are outdated and absolutely wrong, make it really, really hard on women in that situation, right? So I'm very excited that you will be both presenting on this, and it's long overdue. I'm very excited to hear more, learn more. I know I can learn a lot from the two of you. And briefly, before I let you go, your presentation, ADHD and pregnancy, what midwives need to know. So the two of you, what do you hope our viewers will take away from that presentation? And I'll start with Dusty.
I think it would be great if people had a more holistic understanding of what ADHD looks like, right? Again, to sort of combat some of those negative stereotypes and those kind of assumptions that we make about people, so that, it's, if you have ADHD your whole life, you're very defensive about the way that people see you because people make those assumptions. So the more that we can create safe spaces for neurodivergent pregnant people, the more comfortable they're going to feel asking for the help that they need. And then also, I hope that people will have a greater understanding about the role, the complexity of medication during pregnancy. It's not an easy answer, but it's not always just no and don't do it and it's bad. There's a lot to consider there, and it's much more nuanced than I think a lot of people are getting from their doctors, which is really unfortunate.
Yeah, absolutely. Yeah, and I liked how you said a safe space. That sounds great. Thank you. And now over to you, Alex.
I'm hoping that neurodivergence gets on the radar for midwives. I hope that there's screening, and I hope that they leave with some concrete resources that they can offer up to their clients.
Wonderful. Oh, thank you so much. And before I let you go, how can midwives, care providers, women, families, anybody can find you who's interested in that topic and who wants to find out more also about the services you offer? Where can they find you?
Do you want me to go first, Alex? Yeah. So my website is vancouveradhdcoaching.com. So that's just VANCOUVER ADHDcoaching.com. And our pregnancy journal is available on the web store there. If people have accessibility issues around cost, you can always email me. Everything is always available, free or sliding scale, for people who are low income. So that's just to contact at vancouveradhdcoaching.com. And we're both on Twitter. So I'm just at Dusty Chipura. Alex, what's your Twitter handle?
I'm at Alixandra Bacon with an ALIX. Yeah.
I have a YouTube channel that's just Dusty the ADHD Coach. And you can also find me on TikTok if you are hip and young. And you do the TikToking.
That's wonderful. And Alex, some more information where people can find you as well?
Yeah, so you can find me at bacon.alix, ALIX, @gmail.com. And you can check out through vancouveradhdcoaching.com as well. Dusty does group coaching for pregnant people. And I kind of drop in as a guest once a month on that. So you can find us there as well.
Wonderful. Thank you so much. I'm so excited about this presentation and I can't wait. And thank you for spending time here with me today.
Thanks, Kristen. We're looking forward to the presentation.
Thank you.
And for our viewers now, if you would like to find out more about this presentation and the other presentations in the conference, we would like to invite you to go to goldmidwifery.com. I hope I see everyone at the conference. Bye-bye, everyone.